Welcome to Eternal Vitality podcast number 16. Today I'm going to tell you the risks of why getting stem cells outside of America exists. People ask me often, what's the difference between getting stem cells, or aptly named orthobiologics or cell therapy, in the United States at either my clinic or one of the other clinics around the country versus going somewhere else. So I wanted to break it down today to help explain it in a simple, concise way that helps to describe exactly why that they may not be telling you, and breaking down the differences so that you understand. Yes, there may be a cost difference, but unfortunately, there's a lot more to it than just cost. So if you haven't been here before, I'm Dr. Jesse Morse, a family and sports medicine physician practicing in Miami, Florida. I practice at the Osteopathic Center. We have 4 locations. I'm predominantly at the Miami one. Now, the majority of my time is spent seeing patients for orthopedic and non-surgical sports medicine related injuries. And I am a regenerative medicine specialist, meaning I don't do surgery and I don't do steroid injections or anything temporary. My goal is to help the tissue heal and strengthen as much as we can to get rid of pain, to improve strength, improve mobility, and allow you to get back to the things that you love to do. Whether you're 15, whether you're 30, whether you're 70, it doesn't matter to me. My goal is to help you live a longer and healthier life doing the things that you want to do without band-aiding it, preventing surgery, avoiding surgery if possible. I see my fair share of professional athletes and your weekend warriors, and we have access to all these types of amazing treatments that unfortunately are not discussed in traditional medicine because they are not covered by insurance, and orthopedic surgeons want to cut. It makes sense. They're a surgeon. These things have been around for 20, 30, almost 40 years now. There is some mixed reviews on many of them, but my partner and I have been doing this for almost 15 years, and the data in our benefits speak for itself. Our patients, for the most part, are really happy, and you're able to make a lot of progress with these types of injections if you know what the diagnosis is, put the injections in the right spot, use the right product or potency of product, and the right volume. That's the magical combination. If you skimp on any one of those, and that's what we're going to talk about today with some of these in the foreign countries, you're going to have subpar results. And that's why I say, stem cells, they don't work. There's a lot more to it than that. You can't just say a generalized term because it is way more specific than that. I will refer you back to my previous episode about stem cells or orthobiologics in general as more of a refresher or a kind of laying the groundwork. This is going to be specifically about the risks and differences of the United States availability versus something like a Panama or Colombia or Antigua or Mexico or any one of those. So I will first start with a story of a patient that called me a couple weeks ago. And he said, I had a really bad injury several years ago, and I wanted to go. I didn't want surgery. Most of the surgeons said it wasn't really worth it to do surgery. It wouldn't really help my problem. So he ended up going down to, ended up being in Colombia, and he ended up getting a couple injections in his lower extremities, probably his ankles and his feet, as well as IV stem cells. Now, that wasn't the concerning part. When he came back, he had this burning, crazy pain that it's been 3 years and he has been through countless doctors. And he wants to know what happened and why that he has this pain that he didn't have when he went down there. And now he has it in a completely different type of pain and way, way crazy. So what in my opinion, what likely happened was he likely developed what we call an endotoxin reaction. So a lot of these clinics, what they do is they'll put some stem cells or biologics, and I'll break it down in a minute, into these areas. Say it's the ankle, say it's the foot, say it's the knee, whatever it is. But then they'll also pump you full of IV, and basically IV stem cells, growth factors we'll call them. And a lot of the problem is some of these are not clean. Some of these we don't know the source, and they may have some toxins in them because of how they're made or how they're preserved or how they're replicated. And as a result, that toxin can interact with your body and sees it as a foreign invader. And then when that happens, you have some significant issues that you have trouble getting rid of. And it's like, well, they're not going to listen. You can't just call them up and say, hey, I have this pain. What are you going to do? They don't care. They already moved on. They collected their check. They're no longer going to pay attention to you because you're no longer important to them. They don't live by the FDA guidelines. So now it's up to you, the patient, to figure it out. So what do you do? So now you have to scramble and figure out, hey, I need to figure out what I'm going to do, how I'm going to get rid of this pain. What is this pain? And I just don't want to mask it. I want to figure it out. I want to get rid of it. This is one example of probably countless. And if you have more, I would love to hear them. Please send them to me via email, via messaging on one of these platforms. Hit me on Twitter. Whatever you do, I would love to hear more about your stories, whether good or bad, from foreign country stem cells, whether you went all the way to Europe, all the way to Asia, or any of the South American or Caribbean countries. So I'll first start with saying many of these are basically located in anywhere that the United States government does not have jurisdiction. So the first thing I want you to think about when I say that is why. Why are they going there? The reason, for the most part, is to escape the red tape. Whether it is taxes, whether it is the FDA, whether it is safety purposes, whatever it is, they're out of the jurisdiction, so they no longer fall under the guidelines. So they're doing these things because these are considered illegal in the United States. Then that begets the question, why are they illegal? Okay, there's certain things that maybe they shouldn't be illegal. Maybe they're just frowned upon. And other things that are like, yeah, they definitely should be illegal because we have not been able to prove that that's safe and healthy. Now, we heard about Kobe going to Germany many years ago. He got something likely what we call IRAP, which is the purest form of a protein that's found in bone marrow, actually. And then we've heard about all different of these professional athletes. George Kittle, I remember seeing him on a website. I think it was from Mexico. I remember Kirk Cousins talking about going to, I think it was Antigua or one of the Caribbean islands. There was another, I think it was guy played for the Bucks. He went somewhere down there. I know several MMA fighters that have been to BioAccelerator, which is in Colombia. And there is another one, a UFC affiliate, I think it's in Mexico or somewhere, maybe it's in Panama, that have another connection over there. So there's a lot of places. The problem is, what about them? So that leads me to the next important topic and question I want you to ask. What is the source of these cells? So in America, we have two forms of quote unquote stem cells. To make it easy, I'll say stem cells. PRP is not considered one of them. So you have bone marrow coming out of your hip traditionally, and then you have adipose or fat coming out of usually your posterior flank. Both of those have what we call MSCs or mesenchymal stem cells, or really growth factors. To make it easy, growth factors, cell-based therapy. A lot of the times we mix these with PRP, and then you can put them back into the body pretty much immediately. Take them out, put them back in, clean them up a little bit, sometimes in a centrifuge, or mix them with something else in PRP or something like that. Now, there are some growth factor lines, different allografts available in America. Many of these are approved by the FDA. Most of these are used in an OR type setting. Okay, Stryker has a product that is a amniotic tissue-based graft that they use to wrap Achilles tendons in the OR and a bunch of other different types of surgeries. So these are all available. There's another line that is a growth factor based. It's a placental growth factor based that was that's basically extracted out of a placental stem cell. They isolate it, they clean it, they multiply it in the billions, and then it's in a frozen vial, basically. And Kim Kardashian happened to make that relatively famous. Those are called exosomes. And there are some trials and some different things coming out of the COVID times that are associated with those. The data hasn't come out on those yet, at least true full data, but those are available. Those are more growth factor lines. And I think they have a lot of promise. We need to know more about safety. And there's a lot of garbage out there, so you have to be careful. But the question, if you come into an American clinic, they should be able to tell you, hey, this is where the product's from. This is the packaging, everything you want to know. It's right there, it's straightforward. Now, the problem with these foreign countries is that you don't know where they're coming from. They could say whatever they want, but can you prove it? So if you think about it, are they harvesting women, kidnapping them? I'm speaking hypothetical here. Harvesting women or paying women, which is essentially trafficking, taking their organs out, taking their placenta out, taking their amniotic sac out, the umbilical cord out, cleaning it, and then splicing off X number of pieces, then usually multiplying it and having it available. So the problem is you don't really know where these sources are coming from. Do they have HIV? Do they have COVID? Do they have any of these spike proteins? Do they have Ebola? There's so many different things that you don't know. And where are they coming from? Are they coming from Cambodia? Are they local to wherever that country is? I highly unlikely doubt they're coming from America. It's because the cost to analyze a lot of this stuff and get it out of here from a legitimate lab would be pricey. So think about that. Where are these coming from? What are the risks associated with this? All right, I may say 5, 10, 20, 50% compared to the United States. But is that worth the risk of the unknown? And that's the question you have to ask yourself. Who is monitoring these products? Who is screening these products? The FDA isn't. The FDA has nothing to do with these. That's the reason why they're in other countries. So think about that. That's first thing, source of product. Second issue I have with non-US based stem cell clinics. Safety. Ties in with the first one. As I mentioned earlier, are there any endotoxins, which are these tiny little toxins that you can't see, that are usually linked in with a lot of the preservation or cleaning? And if you don't get them out, you can have massive interactions. And the receivers, like the patient that called me, can have issues, and now they don't know what to do. Now you have to throw the kitchen sink at them to get that reaction to calm down in their body. And the problem is when they do IV, guess where it goes? Everywhere. You don't have a choice. Hey, I only want it in my right foot. Not with an IV. Once that heart pumps a couple times, it's over. It's all over. So that's part of the problem when you start pumping things in your veins that you don't know where it's coming from or what's in it. You can't properly screen it. You have to basically take them at their word. And if there's any issues, either immediately or after, how comfortable are you in a likely foreign setting? Probably unsafe. And if you were to come back to the United States, now what do? You're going to call them and, hey, sorry, I can't help you. So now you just put yourself in jeopardy. Okay? If this is a US-based clinic, there's a lot more things that you can coordinate. Hey, this doc, hey, I do this. Hey, go see this ER. The ER calls you, not a big deal. Straightforward. This is what we use. This is what it is. This is the protocol to fix it. You lose that luxury when you go out of the country. What about stability of the cells? So many of these clinics, to make it easy, will just say, hey, they buy 1 million, quote unquote, stem cells from wherever. But 1 million is not going to be enough. That may last a patient, maybe it's a half a patient. Maybe they usually do 50 to 700 to 75 million to 100 million to 150 million, depending on the source, for one patient for one body part. If you're doing IV, you're doing joint, like it gets complicated. So say a clinic just buys 1 million stem cells from a place. So what are they going to do to get it to 100 million? They're going to multiply it. So let's say they initially multiply it times 10. That's round 1. They multiply it times 10 again. That's round 2. Now they have 100 million cells. Okay, that might be enough for one patient. So what are they going to do? They're going to multiply it a certain number of rounds to get the volume that they're looking for. Here's the problem with that. We can't do this in America. That makes the tissue and the cell more unstable with each round. You're making it weaker with each round. The other issue that they may experience, these cells, after about the 6th or 7th pass, it seems to be, 7th multiplication, there's a possibility that those cells can become unstable. And in my head, unstable in this sense of the term means cancer. You'll never prove it. It may take 10 years to happen. But you do not know what that cell is doing and where it's going in the body and what it's causing. When you start manipulating cells, it's the wild, wild west. And that's part of the problem. It may be fine and dandy when you leave, but what if something happens 5 or 10 years down the road? You'll never be able to prove it was them. And now you're stuck with a bigger, huge problem. And you were just trying to be in less pain or live a better, healthier life. So not many people are probably willing to talk about this, but obviously I'm comfortable talking about this because I interact with this space enough to be able to discuss it comfortably. We touched on this a little bit ago. A lot of these clinics put a little bit of injections into the joint. Say it's knee, say it's shoulder, say it's hip, say it's spine. Okay? Put 20 million cells, 50 million cells, but then what do? They're not going to do a comprehensive injection approach. They might put maybe 2 or 3 injections in there. But what do? They say, we'll take care of it with IV. Be careful with these. I mentioned the endotoxins. A lot of people can have reactions to these cells, can have reactions to some of the formulants, some of the things that they use to store them. And Lord knows what else is in that cell, what else is in that IV. And the problem is you may feel good for several months, but the injury will come back, whether it's 3 months, 6 months, maybe a year later. The majority of the time I see this, it is temporary. You're flooding the body with growth factors, aka stem cells. Of course, you're going to feel better. The problem is most of the time you're not getting to the root of the problem. So once things calms down, guess what? Come back. The same symptoms, maybe a little less severe, that you started with. There's 2 more sections I want to talk about for this specifically. The first one is technique. So a traditionally trained orthopedic or sports medicine like myself, say we're doing a knee to make it easy, you may do 1, maybe 2 injections in the knee. You're going to hit intra-articular, meaning the joint, for meniscus, for cartilage injuries, for arthritis. And then maybe you hit, a single ligament or a tendon. Okay. You're hoping all those cells find every single nook and cranny causing the issue. Here's the problem. The majority of those injuries are not in that joint, in that balloon. It is not going to magically go find that injury. You have to put it exactly where the injury is, then it can go to work. It's not going to magically find it. That's the problem I see with these type of places. If someone has multiple different injuries within one body part, and that's usually the issue, whether or not the MRI says it, just because something is mild and obvious on exam doesn't mean it's going to show up on ultrasound or going to show up on MRI or X-ray. You have to use your clinical intuition to say, hey, this tissue is weaker than it should be. It may not be fully torn like the big injury, but this area should also be addressed to collectively strengthen everything up, not just one or two and then hope therapy fixes everything. Inject everything in a more comprehensive approach, and then let therapy work out a lot of the abnormal things that you developed over the years, your compensation patterns. Now, the next question I want you to ask you is, where was this doctor trained? Why are they doing this in this country? Are they reputable? Do they know what they're talking about? Do you even know who's going to do it? Think about that. The next question, this is a huge one. What if they inject an artery, a nerve, or a vein? What happens? Do they have someone there? Do they have a local facility that can help you? I inject every day. You're going to hit some small vessels. They're not a big deal. But if you don't know what you're doing, you can injure someone very easily. You can easily put a needle right here in my shoulder and it will be fine. If I move that needle 1 inch closer to my neck, it's going into the lung. That just becomes a huge problem. You have to know what you're doing. You can't just wing this. Where were they trained? What happens if something goes wrong? What about spinal injections? What happens if they happen to get infection in your spine? This is a surgical emergency, sometimes life-threatening, unbelievably painful. This, unfortunately, can happen. Not super common, less than probably 5%. But how is it a sterile room? Is it a sterile technique? My guess is this is not a super, OSHA checked facility that was cleared by the FDA and all the powers that be. Unlikely. Think about all these different things before you decide to wire money. You don't know what you don't know. My goal is to educate you, but also to inform you and help prevent some issues that I see and help to answer some questions that I get often. This is not a one-word answer, a one-line answer, as you can see. The last thing, cost. There is a classic saying, you get what you pay for. Unfortunately, very true. You have to ask yourself, why is this cost so cheap? If it works as good as it says it works, shouldn't it be more money? Where are they getting these cells that they can charge this price? How safe is this at this price point? If you're getting a stem cell injection for $3,000, what are you really getting? They're probably not covered with malpractice insurance. They probably have people that don't really know what they're doing helping. There is risk all over the place here. Is that really worth saving $3,000, $5,000, whatever the price is? Is that increase in risk worth the savings to your bank account? It might be. But just understand the risks that are involved. I've seen injections in other countries cost 30, 50, 75K. They're not all cheap. And some clinics are more reputable than others. Some of them are American doctors that fly down there, inject patients, and then fly back. Understand that in general, stem cells are not cheap, whatever the source may be. You may find a place that will do it for cheap in the US, but in general, these are not cheap. You get what you pay for. You have to pay for experience. You have to pay for continued training, high quality products. The lab, the processing of this stuff is expensive. This stuff is not cheap. The overhead, the malpractice, there's a lot of levels to this, and there's a reason why these things are expensive in America. I would say cheapest you should be able to get a stem cell line for is about $5,000. And then depending on what you're getting, I've seen well over 100. No problem. If you're doing 15 levels of the spine, both shoulders and both hips and both knees, okay, you just did 75% of your body. It shouldn't be $20,000. You know, think about how many injections that's going to take. Think about how much risk there is. Think about needle guidance and where that needle needs to be and where that product needs to be. Think about how much product needs to actually fix or strengthen that tissue. $5,000 is not going to cut it. I'm sorry. Hopefully this was enlightening to you. I'm here to warn you to do your own research, and this should be part of it. Before you sign up for BioAccelerator or R3 or any of these other clinics in different parts of the country, world, yes, you can save some money, but the amount of risks associated with these places is astronomical. Thank you for tuning in. I hope you found this interesting. Please share this with your friends, your loved ones. If you wouldn't mind leaving me a review on either Apple, Spotify, or YouTube, depending on where you found this. I try to make content that is helpful for you and your family and your friends to help live a longer, healthier life. If you want a specific topic talked about, please put them in the comments and I will happily take that in consideration. Thank you very much. We will see you next week. Take care.